Welcome to Concept in Medicine. In today's tutorial, we are going to be looking at the extraocular muscle. Let's begin. First of all, you should know that there are 7 extraocular muscles divided into 2 groups in relation to the function they perform. So in that case, the first group will be muscles responsible for the movement of the superior eyelid, and that would be the levator palpebra superioris. Then we have the muscles responsible for the movement of the eye, and that will be 6 in number, divided into 2 groups. We have what we call the recti muscles and the oblique muscles. There are 4 recti muscles and 2 oblique muscles. For the recti muscles, we have the superior rectus, the inferior rectus, the lateral rectus, and the medial rectus. And for the oblique muscles, we just have the superior oblique and the inferior oblique. Let's move ahead and look at the extraocular muscles one by one with regards to their origin, their innervation, their blood supply and venous drainage, and their function. Let's begin by looking at the first one, that's the superior rectus. The superior rectus originates from what we call the annulus of Zinn, which is a common tendinous ring. And with all the rectus muscles, they originate from the annulus of Zinn, which is a common tendinous ring. And for the common tendinous ring, it can be located at the orbital apex. So all recti muscles originate from the annulus of Zinn. Alright, with the innervation of the superior rectus, it comes from the 3rd cranial nerve, that is the oculomotor nerve. And when we are done with this, we will look at an easy approach to remembering the nerves that innervate the extraocular muscles. Let's move on and look at the inferior rectus. The inferior rectus also originates from the common tendinous ring, also known as the annulus of Zinn. Its innervation is coming from the 3rd cranial nerve, that's oculomotor. The medial rectus originating from the annulus of Zinn, also innervated by the 3rd cranial nerve, that's the oculomotor nerve. Then we move on to the lateral rectus. The lateral rectus also originates from the annulus of Zinn. For the lateral rectus, it is innervated by the 6th cranial nerve, known as the abducens nerve. Superior oblique. For the superior oblique, it originates medial to the optic foramen, where the optic nerve, that's the 2nd cranial nerve, exits the cranium. For the superior oblique, it is innervated by the 4th cranial nerve, that is the trochlear nerve. The next extraocular muscle is the inferior oblique muscle. For the inferior oblique, it originates from the depression on the orbital floor near the orbital rim. And for the inferior rectus, it is also innervated by the 3rd cranial nerve, that is the oculomotor nerve. Then finally, we can talk about the levator palpebra superioris. The levator palpebra superioris originates from the lesser wing of the sphenoid bone. And for the levator palpebra superioris, it is innervated also by the 3rd cranial nerve, that is the oculomotor nerve. Let's move ahead and look at the blood supply and venous drainage of the extraocular muscles. So we should know that for the extraocular muscles, their primary blood supply is going to come from the muscular branches of the following arteries: the ophthalmic artery, the lacrimal artery, and the infraorbital artery. And with regards to the venous drainage, it is going to be similar to the arterial supply system. And all venous drainages goes into the superior and inferior orbital veins. Let's move on and look at the functions of the extraocular muscles. We'll start by looking at the superior rectus. And with the functions, we are going to divide them into the primary, the secondary, and the tertiary. So all that have the single mark are the primary, and those with double marks are the secondary, and those with the triple marks are the tertiary. With the superior rectus, its primary function is to elevate the eye. The secondary function is what we call encyclotorsion. When we say encyclotorsion, we are referring to the medial rotation of the eye. That is what we call encyclotorsion. The tertiary function of the superior rectus muscle is adduction, meaning it moves the eye medially. It moves the eye towards the midpoint. Let's move on and talk about the inferior rectus muscle. For the inferior rectus muscle, its primary function is the depression of the eye. Depression of the eye. Then the secondary function will be excyclotorsion. And when we say excyclotorsion, simply refers to the lateral rotation of the eye. And its tertiary function would also be adduction, meaning it draws the eye medially. It moves the eye medially. It moves the eye towards the midpoint. Let's move ahead and look at the next extraocular muscle. That will be the medial rectus. For the medial rectus, it only has a primary function. That would be adduction of the eye. It moves the eye medially. The next extraocular muscle, we are talking about the lateral rectus. For the lateral rectus, its primary function is to abduct the eye, abduction of the eye. It moves the eye laterally. Let's move on and talk about the superior oblique muscle. For the superior oblique muscle, its primary function is encyclotorsion, meaning it causes the medial rotation of the eye. The secondary function will be depression of the eye. Then the tertiary function will be abduction of the eye. The next one we are talking about is the inferior oblique muscle. For the inferior oblique muscle, its primary function is excyclotorsion. And when we say excyclotorsion, simply is the lateral rotation of the eye. Its secondary function is what? Elevation of the eye. And its tertiary function is also abduction of the eye. Then finally, the levator palpebra superioris. For the levator palpebra superioris, it has only one function, which is primary, which is elevating the upper eyelid. So the levator palpebra superioris only elevates the upper eyelid. In that regards, let's look at an easy way to remember the innervation of the extraocular muscle. And that easy way is to remember LR6, X04, R3. The LR standing for lateral rectus, the 6 meaning the 6th cranial nerve, XO standing for superior oblique, 4 meaning the 4th cranial nerve, then the R mean the rest. When we are talking about the rest, we are talking about the superior rectus, the inferior rectus, the medial rectus, the inferior oblique, and the levator palpebra superioris. So in that regards, we are saying that the LR6, X04, R3 simply means the lateral rectus muscle is innervated by the 6th cranial nerve, that is the abducens nerve. The superior oblique is innervated by the 4th cranial nerve, that is the trochlear nerve, and the rest, including the superior rectus, the inferior rectus, the medial rectus, the inferior oblique, and the levator palpebra superioris are innervated by the 3rd cranial nerve, which is the oculomotor nerve. I believe we've learned something interesting today. But before we end the lesson, I have a question for you. The question is, what is the antidote of beta blocker intoxication? Do well to leave your answer in the commentary section. Kindly make sure to subscribe to my channel, comment, share, like, and also comment the next concept you would like to see on my channel. My name is Dr. Adele, and once again, this is Concept in Medicine. Bye-bye.